Good.
A few things that I want to elaborate on. So, here you have a serious diagnosis that is, probably deadly if it goes untreated. And the clinic doesn't call you back for 6 weeks. And just think, you're a healthcare professional, so that's not appropriate. Imagine if you were just a lay patient that doesn't know how to navigate the system, and you just fell through the cracks like that. Unfortunately, as you'll probably agree, this seems to be more common than not when it comes to healthcare anymore. This is the kind of service we get. Now, from what I understand from what you told me about this Oasis of Hope Hospital, is that once you decided to use them, it was a totally different situation. Correct?
Absolutely. It was, yes. So I gave them a call on a Monday. They returned the call right away, and I was already in the hospital that same week on Thursday.
In Mexico?
In Mexico, in Tijuana, Mexico. So I'm in Washington State, and I flew into San Diego, California, and a great driver, who's actually now a friend of mine, picked me up at the airport, took me over the border, and right into the hospital. So that evening on Thursday, I received my first treatment, which was just detoxification, simple stuff that they start with. So that's how quickly everything went. Granted, somebody might say, hey, you paid them a lot of money. So, and I like to, give people an idea of how much it costs. So it was $30,000 for my 3 weeks of initial treatment, which was the whole shebang. And I'll explain what that involves.
Okay, let me just elaborate on that. And you can help me. $30,000. What do you think the chemo treatments locally would have been? I'm guessing well over hundreds of thousands of dollars, correct?
Absolutely.
So it's not expensive. Now, one of the reasons why is this place, and I'm looking for you to converse with me. My guess is that this place doesn't take traditional insurance. Is that correct?
That is correct.
Okay, well, there you go. So elaborate on that, because from what I understand, because I know your story from talking to other people also, is you have a health sharing ministry, and even though it wasn't covered on typical insurance, your health sharing ministry did end up reimbursing you for this, correct?
No, that is not true.
That's not correct.
I know a lot of stories. I know a lot of stories of women doing similar treatments and men, and they have been reimbursed by health sharing ministries 100%, except for their small deductible that they paid initially. But then everything else was covered. I unfortunately did not have a health sharing ministry insurance. I wish I did. I wish I did. What reimbursed my first $30,000 were my friends, family, and strangers. A friend of mine started a GoFundMe page, and on the day I was supposed to pay $30,000 to this hospital, they had $30,000 in my GoFundMe account. So whenever
that is wonderful.
Whenever somebody's seeing
well, and just to elaborate on that, what a health sharing ministry is.
Yes, we'll do.
And we talked a lot about it on our podcast, and it's probably something we can reiterate again. But a health sharing ministry is basically where believers in Christ from all over the world give money in a pool to give to people that get sick. And really, even though you didn't have a traditional health sharing ministry in the sense, what you just explained is a health sharing ministry.
Yes, exactly.
Exactly. And that's how they work. And sometimes it's unbelievable for people to believe that can work, but it works. It works. Well. Right. So I'm sorry to keep interrupting you, but I want to elaborate on costs and and how actually when $30,000 sounds expensive, it's really not when you look at the other options.
Yes.
Right. So, and the other option, you might not be alive today. They wanted to do aggressive chemotherapy. And this is something I do want to get into, that makes people's hair fall out, makes people sick. The chemotherapy can kill them. How many people like you, Olga, took that traditional route and didn't fare very well when they could have done something like you did? So that's why it's so important as healthcare professionals for us to educate and empower patients to make their own healthcare decisions.